Good evening and welcome to our COVID-19 update. I'm Ladi Akiriduluale. Here are the highlights at this hour. Federal government to deploy environmental health officers to reopening schools to enforce COVID-19 guidelines and protocols. KATSINA schools reopen after COVID-19 shutdown. And U.S. President Donald Trump to return to White House this evening, says he hasn't felt better in 20 years. We begin from Abuja, where the federal government has announced plans to deploy 60,000 environmental health emergency volunteers to the 774 local government areas of the country to ensure that the guidelines of the COVID-19 protocols are strictly adhered to as schools reopen on October the 12th. The Minister of the Environment, Dr. Mohammed Abubakar, told journalists that the health officers will be assisting schools adopt basic safety measures, including hand washing, compulsory use of face masks, temperature checks, as well as physical distancing. Dr. Abubakar assures that there will be monitoring and evaluation by the federal government to ensure strict compliance of health protocols by schools across the country.
It's been 7 months since schools closed all activities following the outbreak of the COVID-19 pandemic. Last week, the federal government announced the reopening of schools. And since then, government officials at various levels are not leaving anything to chance as measures to contain the spread of the pandemic are in top gear.
The 60,000 environmental health volunteers will be working with other stakeholders at the subnational level in accordance with the guidelines for the safe opening of schools. The roles of the environment sector generally and specifically that of the environmental health practitioners includes participating in developing detailed protocols, established and maintaining prescribed hygiene standards and practices, including water, sanitation and hygiene, that is wash provisions, additional measures of temperature checks and screening, hand hygiene, access to adequate gender-segregated toilet facilities, adequately ventilated classrooms, and hostels accommodation.
The 60,000 Environmental Health Emergency Volunteer Corps will be on standby in schools to ensure strict compliance with the COVID-19 protocols. These include maintaining water and sanitation hygiene, temperature checks, and physical distancing.
Though it's a continuous process, provided there is COVID-19, the environmental health volunteers are going to continue mounting the surveillance decks and also making sure that the protocol guideline issued by the PTF is adhered to by all learning centers or learning institutions in the country. So it's a continuous process.
While the government is promising to ensure that all protocols relating to the safe reopening of schools are maintained, they are appealing for the cooperation of parents and school authorities to ensure the health and safety of their wards.
From Abuja to KATSINA in the northwest, where heads and teachers of various public, private, and community primary and secondary schools have enforced the COVID-19 safety protocols amongst the returning students and pupils. The enforcement is coming as schools across the 34 local government areas of the state reopened today based on the state government directives, which coincides with World Teachers' Day. A visit to a cross-section of some schools operating in the state capital shows that academic activities are being conducted in line with safety protocols.
We have to try our best to put these measures. As you must have observed, before entrance, the temperature is measured and they're instructed accordingly. Parents have been contacted that every child should come with their personal sanitizer as well and mask, and avoid any close contact anyhow, and of course come with the food and water That is very important to us. And of course, we follow the government directives, KATSINA government directives, to introduce shift system. Like primary 1, 2, 3 will come in the morning till 12:30, and the second shift will resume from 12:30 to 5:30. That is primary 4 and 5. And JS1, 2, 3 in the morning, and the senior ones in the afternoon, second shift. During the break time, we plan to make the break in streams rather than at once to avoid this congestion. And of course, the children are going to be enlightened and directed accordingly.
In Imo State, in the southeast, schools also resumed today following the government's directives last week after months of lockdown. A visit to some of the schools in the state capital, Owerri, reveals reasonable compliance to the COVID-19 safety protocols, while in some primary schools, the management says the first few days will be used for cleaning the environment. Meanwhile, the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, says all modalities are in place in case of any eventualities.
After 8 months of closure due to the COVID-19 pandemic, schools in Imo State have now reopened following state government's announcement of the resumption date. The state government, through the Ministry of Health and COVID-19 Task Force, rolled out some guidelines and protocols for schools to observe as they resume. Earlier today, we went round Owerri, the Imo State capital, to monitor the level of compliance of schools to the COVID-19 pandemic, both primary and secondary schools. While some schools are taking this protocol seriously, some are still finding it hard to grapple with this new normal.
We make provision for things that the sanitizers and buckets for the children to be able to cope so that they will not get this COVID. We are on it. We're preparing very seriously. We're washing the glasses now.
Meanwhile, the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, said the government has put all modalities in place in case of any eventuality, and the state government is adhering strictly to the NCDC and UNESCO guidelines on school resumption.
We're actually following the UNESCO guideline. UNESCO has a very clear plan, which actually consists of 3 main components. One is the planning itself. The planning has to take care of finances, take care of human resources, has to take care of the logistics. So we did have an elaborate plan, but we are dealing with children. And that particular age, the secondary school, is actually the age of people who are by nature not supposed to, they don't normally obey laws. So we have to really have very careful guidelines how they should follow.
Ejitokwe Kuteyi for COVID-19 update.
And as Nigeria marks the World Teachers' Day, the Kaduna State chapter of the NUT has called on the government and other stakeholders in the education sector to work with teachers to protect the right of education and guide it into unfolding landscapes brought about by the COVID-19 pandemic. Speaking at an event to mark the World Teachers' Day, the NUT chairman in Kaduna, Ibrahim Sirajo, notes that COVID-19 has significantly added to the challenges faced by the already overextended educational system globally, and commended the state government's efforts in combating the pandemic in the schools, which enabled students to write both the junior and senior secondary school certificate examinations. Speaking on the adverse effects of the pandemic on the welfare of teachers, the NUT boss appeals to the government to ensure prompt payment of teachers' salaries and to also assist those teaching in private schools with some incentives in order to ameliorate their plight. The NUT further appeals to government to look into the challenges being faced by teachers in the conduct of virtual learning, as many of them lack the technology to carry on such important tasks, even as the union demands adequate security for teachers and students in the schools.
The COVID-19 pandemic has significantly added to the challenges faced by already overextended education system throughout the world. It is no exaggeration to say that the world is at a crossroad, and now more than ever before, we must work with teachers to protect the right to education and guide it into the unfolding landscape brought about by the pandemic. While we commend the state government for the concerted effort made towards combating COVID-19 pandemic in our schools, that made the senior secondary school and junior secondary school students to conveniently write their examination. The issue of teacher leadership in relation to crisis responses is not just timely but critical in terms of the contribution teachers have made to provide remote learning, support vulnerable population, reopen schools, and ensure that learning gaps have been mitigated. The role of teachers in building resilience and shaping the future of education and the teaching profession is quite commendable. At its peak, the recent COVID-19 pandemic and associated school closures directly affected over 1.6 billion students at all levels and 63 million primary and secondary school teachers. In many cases, teachers were required to conduct online learning but lacked basic ICT tools in their own homes. In many places, teachers also found themselves unable to continue education because many households lack the technology and connectivity to allow students to learn online. Globally, for instance, approximately 50 and 43% of learners respectively lack computers or the internet in their homes.
In Edo State, the government is adopting a 3-year program that will train persons interested and who are passionate about teaching to ensure that only trained teachers teach its pupils and students. Governor Godwin Obaseki was speaking at an event to celebrate the World Teachers' Day and honor public school teachers in the state for ensuring that learning continued at home, online and offline while schools were shut down during the COVID-19 pandemic.
It's not a time for giving instructions or handling learning materials for these teachers who have been invited to put their feet up as Edo State and their pupils celebrate them. In particular, the Edo State policy of supporting teachers to achieve results, Edo Star, recognizes the teachers' efforts in ensuring learning continued through online and offline measures while the COVID-19 pandemic raged and necessitated the closing of schools.
I'm glad that Zubair took initiative and decided that our pupils will not just remain at home like that. We devised a means to ensure that we engage them. And I believe that that e-learning platform has come to stay in Nigeria and the world at large.
We are able to acknowledge 20 exceptional teachers across the 18 local government areas who have excelled and distinguished themselves in service.
The governor of the state acknowledges the sacrifice the teachers made and the results achieved.
Approximately 20,000 pupils a week took daily virtual quizzes. This was in spite of the challenges of access and network. Within this period, over 7,000 virtual learning classrooms were created from over 9,000 physical classrooms.
The commendation for the teachers goes beyond words. Some of the teachers who will receive awards here work in rural and riverine communities. They are said to have taken exceptional steps to hold many offline classes for pupils where mobile network connection was poor or smartphones were unavailable for virtual learning. One of them gets a special recognition and award from Governor Obaseki.
To be selected into the Edo Star Teachers Fellow Program. Africa, a sum of 1 million.
From the government's latest directive, schools reopen on Tuesday, 6th October. The teachers again maintain they are ready to continue complying with the COVID-19 protocols, this time in the physical school and classroom environment. Jessica Lubuso, Channels Television News.
And in another bid to enhance optimum performance, President Muhammadu Buhari has approved a special salary scale and new retirement age for teachers in Nigeria. Speaking in Abuja at the World Teachers' Day celebration and represented by the Education Minister Adamu, the president announced the gesture, which is aimed at encouraging them to give their best. The president also increased the number of service years for teachers from 35 to 40.
This set of people are found across every nation. They are the next to nurture children soon after their early days with parents. Teachers help students to acquire knowledge, competence, or virtue that they take with them into adulthood. After the outbreak of coronavirus in Nigeria, schools were shut down in March 2020, making most of the teachers less engaged and uncertain about when schools will be opened again. Since the announcement of school reopening, states have keyed into that, and schools are now reopening in phases. However, October the 5th every year is set aside to celebrate this set of professionals globally. The federal government chooses to appreciate the efforts of teachers, with President Buhari approving a special salary scale and new retirement age for them.
Set our country on the path of industrialization, where our educational system will produce the needed skills and human capital. I have approved the following for teachers and for the teaching profession. Special salary scale for teachers in basic and secondary schools, including provisions for rural posting allowance, science teacher allowances, and peculiar allowances is hereby given.
After years of lack of motivation, it appears the teachers can also enjoy the fruit of their labor with an enhanced salary package and longer years in service.
And schools have resumed academic activities for the 2020-21 academic year in full compliance with the COVID-19 protocols in Ebonyi State. Its Commissioner for Education, Dr. Onyebuchi Chima, who monitored the resumption of schools across the state, expressed satisfaction with the teachers and students complying with the NCDC directives. He also used the opportunity to extol the teachers as the world celebrates Teachers' Day, noting that much is required from them as they play a special role in the development of the state.
First of all, let me express my happiness today that at last the Executive Council of Ebonyi State, through our leader, Engineer Dr. David Nwezomai, approved that schools should resume today. And what I'm seeing, having visited some schools, is that the parents, the teachers complied. They are very excited to come back to school after so many months of closure. So I cannot express how happy I am, even though it is challenging in this period of COVID-19. The Ministry of Education, the state government, Ebonyi State government, and the parents, the teachers, and the students have shown their desire that no matter what the COVID-19 challenges might be, they are ready to go back to school. As World Teachers' Day, there is no other better day we could have resumed school in Ebonyi State other than today. It is a reminder of the fact that education stands at the bedrock of development of our state and Nigeria in general and the world at large.
We'll take our break on the program at this point. When we'll come back, we'll have more on schools reopening, plus a medical perspective on all of this and what needs to be done at this point in time to keep the students, teachers, and other stakeholders in the system safe. Please stay on with us. Welcome back to our COVID-19 update. Students in Delta State are also back in school in line with the state government's endorsement of resumption for secondary and primary schools after months of closure due to COVID-19. Their teachers have a lot of role to play to ensure safety protocols are enforced. Before now, Delta State government, through its Ministry of Basic and Secondary Education, had distributed materials in various schools in compliance with the COVID-19 prevention protocols as directed by the authorities. Students on arrival are screened at the gate with temperature checks and hand wash before they are allowed into their classes. The usual assembly protocol is cancelled and learning takes off immediately. The arrangements here entails that only 20 students are in a class. Schools are provided with water storage tanks, liquid soap, sanitizer, free face masks to students and teachers as well.
That there are 20 students in a class, I think it's minimal enough for any teacher to always, watch them and be guided. Definitely with 20 students in a class, we'll be able to know those that are not putting on face masks, those that are not, abiding by the rules of the government. So definitely few students in a class will enable us carry out the guidelines from the government. So with a few students in a class, I think we are good to go.
We are fully prepared. We are fully prepared for the reopening of school. We've been trained by the state governments, so we have the skills, we have the technical know-how, and what the arrangement should be, the class arrangement and the management of school in terms of the facilities that are needed to be able to, stay safe in school. All of those things have also been provided. The sanitizer is there, the thermometer is there, and we have buckets and even the detergents for washing of hands and all of that. So the COVID-19 protocols will be fully observed in school when we resumed.
A quick check at the latest figures on Nigeria's COVID-19 caseload. The country has recorded 58 new confirmed cases from 8 states and the FCT, with Plateau State leading with 18 cases, followed by Lagos, which had 15, KATSINA 10, Ogun 5, Kaduna 4, Edo 3, Ekiti, FCT, and Ondo 1 each. The figure, the country's lowest in more than 5 months, was confirmed by the Nigeria Center for Disease Control, the NCDC. The last time the daily count dropped lower than 60 cases was in April. At the time, Nigeria had confirmed less than 2,000 infections in total. Let's talk now to consultant public health physician Dr. Alero Roberts. Dr. Roberts joins us from the Ikoyi area of Lagos. Good evening, Dr. Roberts, and let me say a very special thank you for joining us this evening.
Thank you very much, and it's nice to be back on air with you, Ladi.
58 new cases. Let me start with that because that's the story I just finished reading. Somebody asked me to ask, are we actually now flattening the curve if we're getting less than 60 cases overnight? What do you think?
Well, without the appropriate amount of testing, it is difficult to say scientifically whether we are flattening the curve. But one thing is clearly obvious. I've often used this analogy when I'm talking about this. If you throw a fishing net into a lagoon and you don't get any fish, the chances are there are no fish in the lagoon. So the truth of the matter is that because we're sticking to our present testing protocol where people only come forward for testing when they have symptoms, it clearly means that fewer and fewer people are getting symptomatic disease, and therefore probably, yes, it will be safe to surmise that we are flattening the curve.
Of course, this is happening at the same time that we're doing further reopening, and that brings me to the major subject of the evening, which is the issue of schools reopening. More and more states now are taking the bold step, if you like that phrase, to reopen. They waited for some to do it and see if there was to be a backlash before they then stepped forward. But the majority of the schools have now reopened. With everything you've heard about the protocols that they've put in place, do you think this would be adequate?
I think it most definitely is adequate, and I would not say it is a bold step. I would say it is a very necessary step, because one of the things we cannot afford is to complicate the issues with further poverty and poverty-creating scenarios. The children have already lost a lot of time in school. They've lost 6 months of schooling. A lot of the children that didn't go to school did not have access to online resources to learn. So it is a very necessary step to reopen the schools and let us get back to some kind of normalcy. I mean, the protocols that I heard on the program earlier are certainly more than adequate. Don't forget that in a boarding house setting, you are creating a kind of bubble atmosphere where people are not going in and out, and therefore the risk of transmission is much reduced. Then the second thing to remember is that the children themselves who may get infected won't actually manifest serious disease, but they stand to lose a lot more if they lose out on their education as well. So I think this is a very necessary step.
It brings me to one of, well, what some might describe as the complications of this, which is what you mentioned, the boarding facilities. So far, what we have seen are the day schools reopening, which is where the students go in the morning and they come back home later in the day when they become the responsibility of their parents once again. But in the case of, for example, the Unity schools, they're away for 3 months, and as you said, they're in some kind of bubble. But is that bubble really safe, considering that it's not entirely secluded? Some of the teachers come from outside, some of the workers come from outside.
Well, it certainly, I mean, you can't be 100% safe in any situation, but it's certainly a lot safer than if everybody was going backwards and forwards. And if you're talking about secondary schools where the children are older and at the height level of the teachers, so transmission is a lot easier. That had been shown in research that was conducted earlier this year. But in a situation where they're in boarding house, where you've got this bubble effect, you do have much less, far more reduced transmission of the virus. So, like I said, the education is far more important right now than the transmission of the virus among that age group. So while we cannot say 100% safe, it's certainly a lot safer than keeping those children at home. They are adolescents and letting them get up to all kinds of stuff.
Would you agree with those who possibly suggest that at the level in which they are in that bubble and so on, their immunity, I know we've discussed this before, but that their immunity should be boosted by some sort of group medication?
We don't have such a group medication. I would love for there to be a group medication, but we don't have any tried and tested group medication. So certainly what I would suggest to boost their immunity, because immune boosting is a very good strategy, is that they get a very good diet. They get a fully balanced diet consisting of the right amount of proteins, carbohydrates, fats and oils, and certainly minerals and vitamins. That they can get in the boarding school. That should be made available to them.
The other thing here is that the teachers themselves are central to this process because they are the ones who are in charge of monitoring. Today we heard that the federal government is going to deploy environmental health volunteers right across the country, 60,000 of them, to enforce monitoring and compliance. Would you say these kind of people are going to help the process or they are going to further complicate it?
I'm not really sure. First of all, may I say a happy Teachers' Day to all the teachers. We're all here because of you. If we didn't have teachers in our lives, we wouldn't be here. So that's first of all. I'm not sure. The teachers themselves are a far more valuable resource. Don't forget, it's the teachers who would have taught the environmental health volunteers in the first place. And there's no volunteer group that can be truly effective, because a volunteer group in and of itself is a group that is going out and doing work for which they're not being remunerated. I don't know that it's a sustainable strategy. I think what is more important is to make sure the teachers have all the necessary equipment and resources that they need to keep themselves and their students safe. I say let's go with the teachers.
Of course, I mean, the congratulations extend to you. You're a teacher as well, Dr. Roberts. Given the fact that all along, all through this process, teachers have been called upon to do so many things. Switch to online learning, which was not probably part of the initial job description, and a whole host of other things. Now, apart from that, part of their duties also involve ensuring COVID-19 compliance, which is something that was also not part of the initial job description. How do you think they're coping?
It's tough. It is tough. But that's the one thing that teachers are known for. Teachers are known to rise to tough situations. Teachers didn't go into teaching because it was the world's best remunerated job. They went into teaching for a love of what they do, for a love of impacting the lives of the students that they interact with. So I mean, it is going to be really tough, but the teachers have risen to the occasion. I know all the teachers that I have had to interact with who had to literally pivot on a penny to switch to online teaching, and how they developed the resources and how they got into it. Many of them learning about in online teaching for the very first times in their life. And they rose to the occasion because they could see that they were making an impact in their students' lives. So I think, basically, I think we need to be looking more at not just celebrating Teachers' Day on one day and giving them a clap. I think we need to be looking seriously at remunerating the teachers much, much better than they are being remunerated, myself inclusive, of course. And, rewarding them here on earth for the work that they do, because really our national development is in their hands.
We've talked about primary and to some extent secondary schools reopening, but it still seems that we have a bit of a knotty issue with the one of tertiary education. Of course, I mean, the labor issues concerning the teachers aside, there is still the question of facilities, which people keep mentioning will be a really big problem before the tertiary institutions can reopen safely.
That is a reality. That is a reality, and it's so sad that we're talking about this towards the tail end of 2020, a country that has had 60 years of independence, that has watched tertiary education grow everywhere in the world, and that we're still here saying the same thing over and over again is truly a shame. But the fact of the matter is that tertiary education is not something you just go into a supermarket and pick up a shelf. If we had been if tertiary education had been funded the way it ought to have been funded over the years, don't forget that the infrastructure would have been going along with the population and along with the demand for tertiary education. So it's an ongoing discussion and something that is not going to end overnight. We are going to have to transit to online courses, no doubt. But then are the universities being equipped for this? Is the government really serious about providing adequately funded, equipped tertiary education?
The other thing, of course, here is that the teachers, and that was the point, that was what you were saying towards the tail end of your point, are they adequately prepared? Because those who are saying, look, it will take a while before the tertiary institutions are ready for physical learning once again. So online is an alternative, but you and I have discussed it on this program. How many people have access to the online? Even assuming every pupil or every student does, how about the teachers? Have the teachers been trained to make the transition from physical learning to online learning?
I mean, if we had more, sort of more private sector involvement, I'm sure this could be done. But the thing is that we're so busy still with infighting at the very basic level that we're not actually looking to be part of the Committee of Nations of the world and make sure that online courses and online learning is available to our students. And because we've discussed this so many times before, and we're still going to keep discussing it well into 2021, well beyond then even, that the teachers at all levels, primary most definitely, secondary and tertiary absolutely, need to be equipped to deliver what is expected of them. Otherwise, we're giving people very unrealistic expectations of what they're going to get.
In terms of treatment, do you think we're closer to developing or to accessing any kind of cocktail, if you like, or any kind of medication that works?
Every day we are a day closer. As to when it's going to be, I can't tell. Basically, what we're looking for now is the vaccine. The vaccine is far more useful to us right now than any treatment, because there's no magic bullet to the treatment. There are so many facets that need to be treated that for a long time we're going to be left with supportive care. Don't forget, this is how many years later we haven't actually got one single bullet that treats HIV/AIDS or any of the other diseases like that. So it's not something that we're going to suddenly develop a drug that treats it like we did with the antibiotics. We're even losing the war in that area as well. Many people don't even realize that. So I think one of the things, and I was very happy to hear that a couple of some Nigerians have actually developed a rapid diagnostic test, which is going to be a great game changer in the arsenal of managing COVID-19. But if we're waiting for that one magic tablet we're going to be able to buy and say we're cured of COVID-19, I don't see it happening anytime soon, not even if the most powerful man in the world gets COVID.
I would have asked you about that, but instead I'm going to ask you about the testing. I'm going to ask you about the testing that you mentioned and the rapid diagnostic test there. Now, a lot more people are having to do this testing as requirements for quite a number of things, for traveling outside the country, for traveling into the country, for accessing all kinds of facilities and all of that. Do you think this kind of rapid diagnostic test, the homegrown one, if it becomes widely available, could help the process of increasing our level of testing? Because at the beginning of the program, when I asked you about the NCDC figures, you said, look, that would be dependent on if you could guarantee that the required amount of testing was going on. Obviously, we can't.
Right from the very beginning, you know, I'm a proponent for rapid diagnostic testing. So that's a given. The point that we need to keep dealing with was how sensitive those tests were. And a lot of the earlier tests were not sufficiently sensitive or specific for COVID-19. Of course, in the course of this pandemic, that has changed. And the WHO recently accredited some rapid diagnostic testing that have finally met the standard, the minimum standard for sensitivity and specificity. And had actually earmarked how many millions to be rolled out on the African continent. So that is the game changer that we're all waiting for. These tests are 1/10 the price, or a 100th the price of the present PCR testing, and the results come out in minutes rather than days. That will be of great use for if you're thinking of testing for, say, return to work, return to school, or take a flight. If you're ill, the gold standard will still be the PCR test, but then you see we'll be testing against symptoms, which is what our protocol calls for. So I am very happy if the Nigerian tests meet the minimum standard for WHO accreditation, then it can be adopted into the country's arsenal for COVID management. I'd be very happy to see that. I'm incredibly proud.
Going forward, it does seem as if, as has happened elsewhere, we are witnessing some level of COVID fatigue, and that is having impact on compliance with the protocols. Now, we've seen what has gone on in other places where they had witnessed this fatigue, and they're having second waves and third waves. If you go to Europe, I mean, if we talk about Europe now, in Italy and in Spain, in France and so on, who they thought had somehow managed this, they're back to it. Some of them are considering lockdowns. Do you fear that we might be headed in that direction if we don't change course?
It's very difficult to say, and I have to quote the director of the Africa CDC, regional director of the Africa CDC, who when he was interviewed on CNN, was speculating as to why Africa hasn't seen what Europe, US, and the UK have seen. And the truth of the matter is that if you have 70% of the African population that are age 30 and under, and this happens to be a disease that is not as severe in the younger ages as it is in the older ages, we may be well going through a second wave or even a third wave, and we simply will not know because these young people will not show symptoms. Then the other thing we must remember is that because we were a continent and a country, and the whole world said, oh dear, COVID and Africa people will be dying in the streets, we were very, very, very strong on making sure that the public health interventions were carried out early and were carried out widely. So we may seriously have dodged a very serious bullet in that regard. So if you're talking about COVID fatigue, yes, everybody has COVID fatigue. Me included, and you, I happen to know. We are all very COVID fatigued. But the fact still remains that we have been able to strengthen our public health interventions. We have been able to prepare our health system such as it is for what was coming. And we are very, very grateful that we did not see it as dire as was predicted in the first place. That is going to come again in waves. Who knows? The chances are it probably will. But hopefully by then we will have developed the vaccine and we will have gotten access to the vaccine.
It's on that optimistic note that I'd like to thank you, Dr. Roberts, for coming on the program this evening. Thank you very much for your time and for your interesting perspectives, as well as your optimism. We hope it does turn out positive. Thank you so very much.
Thank you very much for having me, Larry.
On October the 1st, 2020, that was Thursday, South Africa reopened its airspace to international travel after 6 months. 57 countries had been barred, and that included the United States, the United Kingdom, Russia, France, Kuwait, and Qatar. All 54 African countries were, however, allowed to travel to that country. South Africa Bureau Chief Betty Dibia reports on day one of the opening.
It's been a 6-month wait, but the flight schedule boards in South Africa have come alive. Today we will be handling 31 flights, both departing and arriving. As early as 6 o'clock this morning, we already handled 2 departures.
The Minister for Tourism, whose sector is counting huge losses these past months, was present herself to welcome the very first flight and crew from Germany, and she's hopeful things will take a turn for the better.
It's important, especially for us in the tourism and business in terms of trade, because Germany is one of our key source markets as tourism, carries quite a huge weight and contribution to our tourism in terms of GDP contribution.
I do really hope that this is a beginning of something good, because tourism and business are important for the re-establishment of the economy of South Africa. And I'm glad to say that South Africa and Germany are in this together.
The authorities say the COVID-19 health safety regulations remain stringent despite the move to open up the airspace and borders to boost the economy under level 1 lockdown.
Judging by what has happened with domestic travel, when we were at lockdown level 3 up until 2, the airlines are now having an 85% load factor. We anticipate that with the peak festive season that's coming up, we should in no time reach a similar load factor for the international carriers.
South Africa still places 57 countries on the barred list because they are considered as high risk, and these are key spender markets. We asked the minister how much that will hurt the economy.
Currently, we only have Germany. Your US is not in. UK is not in. France is not in. So we do have those are our key source markets, and they bring in terms of spend, contribution to GDP. But we understand why it was taken, the decision. And what comforts us is that every 2 weeks there will be a review. So it's not an issue that this list is permanent.
The list of barred countries from South Africa is expected to be reviewed every 2 weeks in accordance with changing COVID statistics.
Let's talk now to Betty. She joins us from South Africa's commercial hub, Johannesburg. Hi, Betty. Nice to see you.
Hello. Same here.
The status report, this international aviation reopening, what's happened? Has it been as smooth as everybody expected?
Not really. I know that the first flight, international, out of the continent flight that came in was Lufthansa flight. You saw the German ambassador in that report, which went well. And that first day, you had over 30 flights, outbound and inbound, that went well, more or less. But I know that somewhere at the weekend, Emirates had to cancel a flight that was going into Durban or leaving Durban. There was an issue where they had problems because the regulations have some contradictions here and there are areas some people do not agree with, especially treatment of crew as regular passengers. But then again, they're human beings and they could be vectors. So that has been, they've been talking about it, and I think there is some agreement point. So Emirates may resume flights. British Airways has indicated that they will resume. I just heard the official from Uganda saying that they will be coming into the country as well. But for the airlines, I guess it's work in progress. But some of the operators locally and other related industries have issues as well, especially with that list I showed at the end of those who are allowed and those who are not allowed just yet. And many of those who are not allowed just yet are the big spenders, the top dollar spenders in the tourism sector.
Well, they also happen to be those from the high-risk countries. So as you pointed out, they are human beings.
Yes, but then again, from the high-risk sectors, there are exceptions. There are those who are investors coming into the country from high-risk countries are allowed. Those called the highly skilled people, the needed skills, probably IT and all that, are allowed into the country as long as they show the required certificate of a negative test. They're allowed even from the high-risk countries. So that's the exception they've given for the investors especially, and then people that are highly skilled.
The people who are supposed to benefit from all this, the small enterprises that sell gifts, those who offer services that mostly international travelers enjoy, have they started reporting any changes to the conditions that led them to agitate for this in the first place?
Not really, not really, especially if you look at that list. There are even smaller European countries mentioned in that list, where some of the local tourism operators are saying, hey, these countries have not reported. I can't remember one particular country, and they're saying, why open up to the whole of Africa, where countries like Morocco are allowed to come into the country, where smaller European countries who have reported very, very little figures in the past few weeks or so are on the list of bad countries. So they're not exactly happy, but they understand as well that the government is trying to protect the country. But they're saying, if you're saying you have to bring in this certificate, certified from a certified physician or the relevant authorities, why not allow anybody to come into the country? But I know these are people, again, who will turn around. If government says, yes, let everybody come inside, they will say government is being irresponsible. So it's still work in progress, and it's not yet holiday season again. But I know that they're positioning. As the minister said, the list will be reviewed every 2 weeks. So those whose figures have improved may get into the allowed countries or permitted countries. And those who were on the permitted countries list and their figures go up, they may find themselves out of it. So it will be reviewed every 2 weeks. Probably by the time it gets to holiday season, November, December, where people really do the spend. In Europe at that time, and even in America, it's a bit cold. It's cold at the time. Here it's warm. That's the summertime in this country. And they have a lot of tourists. Probably at that time, more countries will be on the permitted list. That's what they're hoping.
All right, then. Thank you so much, Betty, for the update from South Africa. And do continue to stay safe out there.
You too. Thank you so much.
Doctors treating the U.S. president at the Walter Reed Military Medical Center say his condition has improved and that he has not had a fever for more than 72 hours. During a briefing this evening outside the hospital, they said the president is to be discharged to continue the treatment for COVID-19 at the White House, as all of his vitals are looking good and he has not had any respiratory complaints. The White House physician, Dr. Sean Conley, informed that the president was given extra oxygen twice after experiencing a drop in his oxygen levels. While they are cautiously optimistic about Mr. Trump's recovery, they say there is nothing that is being done for Mr. Trump at Walter Reed Military Hospital that cannot be done at the White House. And in the meantime, 36,778 coronavirus cases have been reported in the United States in the last 24 hours, bringing the total number of cases in the country to 7,396,730. The death toll has also gone up by 378 to almost 210,000, as the country has the highest number of COVID-19 deaths in the world. Here's our global update.
British Prime Minister Boris Johnson said on Monday that the current soaring numbers of COVID-19 cases was about where government forecasts had predicted, so the next weeks would be crucial to see if local lockdowns could get on top of the virus.
The incidence that we're seeing in the cases really sort of corresponds to pretty much where we thought we were. And to be frank, I think the slightly lower numbers that we'd seen, didn't really reflect where we thought the disease was likely to go. So I think these numbers are realistic.
India plans to receive about 500 million doses of COVID-19 vaccines to inoculate around 250 million people before July next year. The Health Ministry has set up a committee to oversee the entire vaccine supply chain, including vaccine delivery schedules, and at the same time get the manufacturer's commitment to ensure that the maximum dose of the vaccine is available. And in New Zealand, the Prime Minister Jacinda Ardern says coronavirus restrictions in the largest city would be lifted this week, as she expresses confidence that a second wave of COVID-19 infections in Auckland is almost eliminated. And in Russia, the daily tally of new coronavirus cases rose to its highest since May 12 on Monday, as the authorities reported 10,888 new infections nationwide, including 3,537 in Moscow.
Remember that a decline in the cases doesn't mean the curve has been flattened. Continue to take responsibility. Visit our website, channelstv.com. There you get updates and a better understanding of this COVID-19 pandemic, plus other stories on politics, business, and sports. That's our COVID-19 update. Thank you for watching. I'm Ladi Akiridoluale. Good night.